If you're over 70 and someone recently told you your blood pressure is now perfect at 120/80, there's something important you should understand. For many years, we've been told that the lower the number, the better. And for younger adults, that advice often makes sense. But when we look at older adults, especially those over 75, the story becomes more complex. Several long-term studies that followed thousands of older adults found something surprising. Seniors whose blood pressure stayed in a moderate range often did better than those whose numbers were pushed very low. They experienced fewer balance problems, fewer hospital visits, and in many cases maintained their independence longer. In this video, I want to explain why this happens, what blood pressure range is often considered reasonable for older adults, and one simple check you can do at home that may help you notice if your pressure drops too much when you stand up. Before we continue, I'd like to ask you something simple. Write your age in the comments. Just the number. This helps me understand who is watching and which age groups this information is reaching. And if you've ever noticed a moment of lightheadedness when standing up from a chair or getting out of bed, you can add the word dizzy after your age. You might be surprised how common that experience is. Now, let me describe a situation that happens every day in clinics. Someone around 78 years old goes to a routine appointment. Their blood pressure reading might be around 145/85. The number appears higher than the standard target many people hear about, so medication is adjusted. A few months later, the number comes down nicely. Now the reading might be 124/78. Everyone feels relieved. The chart looks good, and the numbers appear ideal. But sometimes something else begins to happen. That same person stands up during the night to go to the bathroom. Within seconds, they feel slightly unsteady. The room may feel like it shifts for a moment. They grab the wall or hold on to furniture until the feeling passes. Situations like this can happen when blood pressure drops too quickly after standing. And for older adults, that drop can sometimes create a risk for losing balance. This is why many researchers today say that blood pressure targets should not always be identical for every age group. What works well at 45 may not always work the same way at 80. There are a few reasons for this. The first has to do with how our blood vessels change over time. When we're younger, our arteries are flexible and elastic. They expand easily as the heart pumps blood through them. But as the years pass, arteries gradually become less flexible. You can imagine the difference between a brand new garden hose and one that has been sitting outside in the sun for many years. The older hose is a bit stiffer. Our blood vessels go through a similar change. Because of this, slightly higher pressure can sometimes help maintain steady blood flow to important organs like the brain. The second change involves something called pressure sensors in the body. Inside our blood vessels are tiny sensors that constantly monitor blood pressure and help the body adjust quickly when we move. For example, when a younger person stands up, these sensors react almost instantly. Heart rate increases slightly, blood vessels tighten, and pressure stabilizes. But as we age, these sensors may respond a little more slowly. So if blood pressure is already quite low, standing up quickly may cause a brief drop before the body corrects it. That short drop can lead to dizziness or imbalance. The third factor involves how the body processes medications. Over time, the liver and kidneys may clear medications more slowly. That means a dose that works perfectly for a younger adult might have a stronger effect in someone older. Sometimes this can lower blood pressure more than intended. Because of these factors, many researchers now suggest that blood pressure goals for older adults should be individualized. Instead of focusing on one universal number, it can be more helpful to look at overall health, energy levels, balance, and daily function. Large observational studies that followed thousands of people over the age of 75 noticed an interesting pattern. Participants whose systolic blood pressure stayed roughly between the low 130s and mid-140s often maintained stability and daily independence longer than those whose numbers were pushed very low. This doesn't mean higher pressure is always better. Extremely high numbers can still place stress on the heart and circulation. But very low numbers can sometimes create their own challenges, especially if they lead to sudden drops when standing. That middle range often appeared to provide a balance. Let me show you why understanding changes in pressure when standing can be so useful. There is a simple check sometimes called a standing blood pressure test. It only takes a few minutes and can give you helpful information about how your body responds to position changes. You can do a basic version at home if you have a blood pressure monitor. Here's how it works. First, lie down comfortably on a bed or couch and rest for about 5 minutes. After resting, measure your blood pressure while still lying down and write the numbers down. Then stand up and measure your blood pressure again right away. Compare the two readings. If the top number drops significantly when standing, it may suggest that your body needs a moment to adjust when you change position. Some people never notice this. Others may feel a brief lightheaded sensation when they stand quickly. If you ever notice large changes in these readings or frequent dizziness, it can be helpful to mention it during your next medical visit. Having those numbers written down makes the conversation much easier. Another important thing to remember is that blood pressure naturally changes throughout the day. One reading in a clinic doesn't tell the whole story. You might see a slightly higher number in the afternoon and a lower one in the morning. That's why many people find home monitoring helpful. Checking once in the morning and once in the evening for a couple of weeks can give a clearer picture of your average range. When you look at the average over time, patterns begin to appear. Now let's talk about general ranges that are often discussed for older adults. These are not strict rules, but they can help guide conversations. For adults between 65 and 74 who remain active and generally healthy, many professionals consider a systolic range around 130 to 140 to be reasonable. For those between 75 and 84, a slightly higher range such as 135 to 145 may still provide stability while maintaining good circulation. For adults over 85, maintaining balance, strength, and daily independence often becomes the most important priority. In these cases, readings closer to the 140 range may sometimes be acceptable if the person feels well and remains active. The bottom number also matters. For many older adults, keeping that number comfortably above the mid-60s helps maintain good circulation to the heart and brain. If it consistently falls much lower, it may be worth discussing during a medical visit. Something else that often gets overlooked is how different two people of the same age can be. Imagine two individuals who are both 81. One lives independently, stays active, and enjoys regular walks or golf. The other may be managing several health conditions and taking multiple medications. Even if their blood pressure readings are similar, their treatment approaches might be very different. This is why many experts today say the goal should be to treat the whole person, not just the number on a screen. So, what practical steps can you take starting today? First, if you don't already have one, consider using a home blood pressure monitor. They are widely available and simple to use. Second, measure your blood pressure at consistent times for a couple of weeks. Morning and evening readings can provide a helpful average. Third, pay attention to how you feel when standing up. If you notice frequent dizziness or instability, write that down along with your readings. Fourth, bring that information to your next appointment and have an open conversation about what range makes the most sense for you personally. A thoughtful discussion based on your age, activity level, and overall health can be much more helpful than focusing on one universal number. Understanding how blood pressure changes with age allows you to participate more confidently in decisions about your health. You begin to see the bigger picture. Numbers are important, but how you feel, how steady you are on your feet, and how well you maintain daily independence matter just as much. If this explanation helped clarify something you've been wondering about, write the word "informed" in the comments. It tells me these conversations are useful. You can also share this video with someone over 65 who might appreciate learning more about how blood pressure changes with age. And if you enjoy clear, practical discussions like this, You may find the next video helpful as well. There we'll talk about a few simple lifestyle habits that research suggests can support healthy circulation as we get older. Thank you for spending these minutes with me, and I'll see you in the next video.